Welcome back. In the chapter of preventive medicine and obstetrics, pediatrics, and geriatrics, in this session we are going to discuss about the postnatal care. Let us begin with the definition of the postnatal care. The care of the mother and the newborn after delivery is known as postnatal care or postpartal care. So we have studied about ANC in a previous video. Antenatal care is before the delivery. Postnatal PNC, postnatal care, is after delivery. Here we are going to take care of the mother as well as the baby. So the taking care of the mother, the responsibility will be that of the obstetrician, and the care of the newborn is a combined responsibility of the obstetrician as well as the pediatrician. Okay, the combined area of this responsibility is perinatology. What is the combined area known as perinatology? Beginning with the care of the mother. The objective of postnatal care are to prevent the complications of the postpartum period. We know the postpartum period after the delivery, that is 6 weeks 42 days after delivery is the postpartum period, to prevent any complications. So we know certain complications like puerperal sepsis, thrombophlebitis, any of these can occur during this postpartum period. To prevent the complications, what is the objective of PNC? Objective, what is their goal? To prevent the complications, to provide the care for the rapid restoration of the mother's health. We know that the organs and the health of the mother has to be restored back to her pre-pregnant state. The uterus and everything, all changes in the reproductive tract have occurred, they have to restore in its original state, pre-pregnant state. So we have to provide care. To check the adequacy of the breastfeeding, we also have to check that we know exclusively for 6 months after delivery, the exclusively breastfeeding is encouraged. So we have to check the adequacy of the breastfeeding. To provide the family planning services to the mother. So we know that if she has completed her family on the second day of the delivery, we should ask her to opt for sterilization. If the family is not completed, for the spacing methods. To provide the health education to the mother as well as the family, we have to provide the education to the mother, the basic hygiene, sanitation, the care of the child, all of that education have to be provided to the mother as well as the family. The basic education you have to provide regarding the health. Okay, this was about the objectives. Let us summarize what were the objectives. In the first thing, we have to prevent any complications occurring. Second, restore the health. Third, the breastfeeding, adequacy of the breastfeeding. Fourth, we have to provide the family planning services. Fifth, we have to provide the health education. So health education and family planning services have to be provided. Breastfeeding has to be checked. Prevent complication, restore health. Okay, 5 things. Moving on. PNC services. So let us see what are all the postnatal services which are available. Starting with the postnatal visits, like how we had ANC visits, we have postnatal visits following the delivery. The home visits which is made by the ANM, that is auxiliary nurse midwife, or the female health worker, is at least 3 visits. So the ANM, that is the especially these ASHA workers, okay, home visits by the ASHA workers, ANMs and female health workers is discussed here. ANM have to make at least 3 home visits. At least 3 home visits have to be made by this ANM. Home visits with ASHA worker after the delivery are as follows. Home visits in cases of home deliveries. We know the domiciliary deliveries, the home deliveries. If the home deliveries have happened, the ASHA worker has to give 7 visits. In the first week, another visits 137 in the first week, first day, third day, seventh day, followed by 14, 21, 28, 42. 14, 21, 28, and lastly 42. Okay. Institutional delivery. In case of institutional delivery, she has to make 6 visits. That is, on the first day, there is no visit. Institutional delivery, na, it's not occurring at home. So, we have to skip the first day because the women will be present there only. So, first day you are not going. The remaining days of visits are we know 1, 3, 7 in the first day. So, first day you are not going. 3, 7, 14, 21, 28, and 42. Okay. If there is delivery by the lower segment cesarean section, if it is a C section, then 5 visits have to be made. That is, no visit on first and third day. 1, 3, there is no visit. So the remaining days 1, 3, there is no visit. Then the remaining days 7, 14, 21, 28, and 42, she is supposed to make a visit. So again guys, home delivery is 7 visits, institutional 6, LSCS 5 visit. LSCS she has to make 5 visits. Home delivery is 7, institutional 6. Okay, 7, 6 and 5. And the dates we have studied. Postnatal examinations. Moving on to the postnatal examination. Soon after the delivery, what happens? The health checkups have to be done frequently to the mother and the baby. So the postnatal examination after delivery, that is twice a day during the first 3 days. We have to check, health checkup has to be done 2 times a day for the first 3 days. Subsequently, once a day till the umbilical cord of the baby drops off. So we see first day, second day, third day. Okay, she has to make 2 visits. Two health checkups have to be done. Not visit, health checkups. Two are done. And once health checkup have to be done until the umbilical cord of the baby falls off. Okay, done. And then at the end of the 6th week, to check the involution of the uterus. So we know involution of the uterus because of the conceiving the baby and everything, the uterus will expand in its size. Now the uterus have to come back to its pre-pregnant state. That is, the conversion of the uterus into its pre-pregnant state or original state is involution of the uterus. At the end of the 6 weeks, that is 42 days, at the end of 42 days, the uterus have to come back to its pre-pregnant state. That is involution of the uterus we have to check. Then hemoglobin examinations have to be done in the PNC visits. So we see that we have to check the hemoglobin levels as well. Next, so that we can rule out anemia. If anemia is discovered, we can treat the anemia. So we do the hemoglobin examination to rule out anemia. Okay. In some cases, we have to continue the treatment, right, for the anemia for at least 1 year or more than 1 year. If it is discovered, we have to treat it. So we also check the hemoglobin levels. Moving on to postnatal exercises. Postnatal exercises, they are necessary to bring the stretched abdominal and pelvic muscles back to normal. So we know that these postnatal exercises will help in involution of the uterus, and also the stretched abdominal muscles, pelvic muscles, they all will be stretched. So they have to come back to normal. To bring back to normal quickly as possible, we have to ask them to perform the general postnatal exercises. The household duties will be enough to restore the one's figure. If they perform this household work, it will suffice. Moving on, the nutrition. So we know that a malnourished mother, though she is able to secrete breast milk, but it won't be sufficient as that of a nourished mother. She will be breastfeeding the baby at the cost of her own health. So we have to make sure that the additional calorie requirements are found during lactation, and they have to be met. So we see that in the first 6 months, the mother has to have an additional 600 kilocalories per day. So we know that A malnourished mother can also breastfeed the baby, but her health is in danger. So we see that it will adversely affect her health. So we have to keep the mother well nourished. So in the first 6 months, the excess calorie requirement is 600 kilocalories per day, and the additional calorie requirements from the 6th month up to 12 months is 520 kilocalories per day. Okay, from 6 months 600, this is how you can remember: 6 months 600 kilocalories, followed by 6th month to 12th month 520 kilocalories. Okay, iron and folic acid supplementation. Now they're talking about iron and folic acid supplementation. Even in ANC, we saw that the 60 mg of elemental iron, now 60 to 100 mg of elemental iron, and 500 mcg of folic acid tablets, that is red color tablets you can see here, they have been provided to the mother. They have to be continued 180 days of postpartum period. We have studied this in ANC lecture. We will also revise it again here. 60 to 100 mg of elemental iron and 500 mcg of folic acid. Okay, elemental iron, elemental iron and folic acid. Elemental iron and folic acid. Elemental iron, how much? Elemental iron is 60 mg. 60 mg. Folic acid is 500 mcg. Okay, folic acid 500 mcg, and this is 60 mg. Moving on to family planning. So, the family planning methods, that is intrauterine devices and conventional non hormonal contraceptives, they are the choice for the women during the first 6 months of the delivery. And the postpartum sterilization is advised for the women if she is having two or more children, and it is usually recommended on the second day after delivery. So every attempt should be made to motivate the mother when she's attending the postnatal clinics, or when she's coming for the follow-ups and checkups. We have to make as possible number of attempts to motivate the mother to opt for the family planning methods. Also, we know that she has to adopt a suitable method for her next birth. If she wants to limit the family size, based on that she has to choose. Okay, and we know which day, second day after the delivery, the postpartum sterilization is usually recommended. So this was about the contraceptives method. Okay. In with regards to this, IUD and conventional, they are given during the first 6 months of delivery. We see that the intrauterine devices and conventional contraceptives, they are the choices which are given during the first 6 months following the delivery. The oral pills, combined oral pills, they should be avoided in lactating mother, because they will suppress the lactation. We have to go for intrauterine devices and non-hormonal. Why have they said here non-hormonal contraceptives? Because this hormonal contraceptives like oral pills, combined oral pills, these hormones can alter, they can mess with the normal hormones, and they can result in suppression of lactation. So we see, but that evidence have shown that progesterone will have little effect or no effect on lactation. But when we take this injections, they are that injection, that is MPA injection, that medroxyprogesterone acetate injection, which is given after delivery, they are successful in suppressing this lactation. Also, there are certain side effects like the prolonged infertility, intrauterine bleedings, irregular uterine bleedings. They have been reported with the use of these injections. So what is the best family planning methods? Intrauterine device and non-hormonal contraceptives in the first 6 months after delivery. And if there is completion of her family size, if she has already had two or more children, then the postpartum sterilization is advised. So this was about the family planning. Moving on to the complications of the postpartum period. So we know that certain complications will arise during the postpartum period. They have to be recognized as early as possible, and we have to deal with them promptly. These complications, they have to be detected at the earliest, and we have to deal with them. Starting with the three, we have three complications given here. The first one is puerperal sepsis. What is puerperal sepsis, guys? The infection of the genital tract within the 3 weeks of the delivery. So we see here the infection of the genital tract. It could also affect the cervix. So we see inflammation and infection of this endometrium, the lining of the uterus can occur, endometritis can occur. So the puerperal sepsis, starting with endometritis, can occur. What are the signs and symptoms? Along with this, if the patient comes with puerperal sepsis, this she will have fever. There will be rise in temperature, and the pulse rate will be high, and the lochia will be foul smelling. Pain and tenderness can be felt in the lower abdomen. So we have to prevent this puerperal sepsis by paying attention to the aseptic techniques before and after the delivery. So it is a very important role of this domiciliary midwifery services. So this ANMs and domiciliary midwives, they have to take care of aseptic techniques have to be followed, so that puerperal sepsis can be prevented. So what is puerperal sepsis? Infection of the genital tract within the 3 weeks after delivery. So the infection, when it occurs within the 3 weeks after delivery, it is puerperal sepsis, followed by thrombophlebitis. Next we have thrombophlebitis. What is thrombophlebitis? You can see a thrombus is a clot of blood. So we see here thrombophlebitis. Thrombo, divide the word. Okay, thrombo is a clot. Okay, phlebitis, itis is inflammation. So thrombophlebitis is a clot, and the phlebitis means inflammation of vein. When a clot of blood forms and creates a block in the vein, it is referred to as, when a clot is formed and it is blocking the vein, resulting its inflammation, then it is considered to be thrombophlebitis. So we see that this is an infection of the veins, especially in the legs. It is frequently associated with those having varicose vein. Then how will the leg be? It will be tender, it will be pale and swollen. The third complication is secondary hemorrhage. When the bleeding from the vagina occurs any time from 6 hours after delivery to the end of the puerperium, that is 6 weeks, it is referred to as secondary hemorrhage. So we see that the vaginal bleeding 6 okay, vaginal bleeding from 6 hours after delivery to 6 within 6 weeks of the puerperium is considered to be the secondary hemorrhage. Why the secondary hemorrhages occur? Postpartum hemorrhage, amount of bleeding from or into the genital tract, okay, following the birth of the baby, 6 hours after the baby to the end of the puerperium, that is 6 weeks. They occur because of the retained placenta or the membranes. If there is any retention of the placenta or the membranes, it can occur. Others, we also have urinary tract infections, complications like UTIs, and we have mastitis, inflammation of the breast tissues. And it is extremely important so that to look into these complications in the postpartum period, and we have to prevent them and treat them promptly. Moving on to the care of the child. So we have two aspects in postpartum care. What was the definition? The care of the mother, care of mother and the child after delivery was postpartum care. So now we see here the care of the child. Now we are beginning with the care of the child. This section will focus on the children. So the care of the child, it can start with the iron and folic acid supplementation to the baby. To the mother also we gave the iron and folic acid supplementation, but they were the red tablets. In cases of the infant or the baby, 6 to 6 years, from 6 days to 6 years, okay, 6 months to 6 years, that is 59 months approximately, the folic acid, iron and folic acid supplementation has to be done. So they are given in the form of syrup. So we can see here 20 mg of elemental iron and 100 mcg of folic acid bi-weekly is given. So there we saw 60 mg of elemental iron and 500 mcg of folic acid in cases of, this is folic acid, this is elemental iron in cases of mother. Okay, for the infant or the baby, we give from 60 it becomes 20 mcg, and 500 it is 100 mcg, from 500 to 100 mcg, the difference. Okay, here 60, here 500 was the value for mother. This is for the infant. Bi-weekly has to be given this syrup. Breastfeeding, and now we know that exclusively the breastfeeding has to be done for 6 months after birth. Nothing else but breast milk is given to the baby after the birth. Weaning period, we know at the age of 6 months the breast milk is supplemented with protein rich supplementary foods. So what is weaning? Along with this breast milk, we are also including we are supplementing the breast milk with protein rich supplementary foods. So we can see the protein rich supplementary foods like the animal milk, that is buffalo milk, goat milk, cow milk, animal milk. The mashed vegetables, fruits have been supplemented to the baby along with the breast milk at the age of 6 months. So this was about the care of the baby. With this we come to an end of the postnatal care or the postpartum care. I hope everything is clear. If you have any doubts, put it in the comment section. Now let us just have a look of the MCQs we have got in postnatal care. The delivery visits can be asked in Viva voice. Viva question could be there. The delivery visits, the home delivery visits are 7, institutional 6, and LSCS 5 visits. We know the numbers 1, 3, 7, 14, 21, 28, and 42. Okay, so done. Next, this additional calorie requirement. So in the additional calorie requirement during lactation, in the first 6 months 600 kilocalories, in 6 to 12 months we have 520 kilocalories. This is all about the MCQ which has appeared in the previous question papers for your NEET pre-PG examinations. Thank you. If you like the video, hit the like button and subscribe.